Welcome to Salma Hospital. Salma Hospital, we had one guiding principle from the beginning. We want this to be different. Different in terms of we want a high level of specialization. We want every employee and every stakeholder to be being part of a bigger concept, being part of the Salma family. From day one, we also wanted to focus on detail because the detail is what matters. From the design phase over building the constructions, choosing and recruiting every single nurse, doctor and therapist, up to now setting up the processes and running this facility. This all accompanied with one question. If it was your own kids, what would we want for them? How would we want someone to take care of them?
Each ward of the hospital has a different color scheme. So for example, this ward is red. So when the patient who's living here leaves the area and goes to a therapy session or goes to another area of the hospital, when they return, when they see the color red, they know that they're coming home to their room. So it's a way that we create a home-like atmosphere for our kids.
At Salma, we bridge the gap between hospital and home care. What sets us apart is our compassion, our commitment, and our full devotion to involve the families in the care of these pediatric patients with complex care needs. Pediatric care nursing is one area of nursing expertise that is constantly evolving and is dynamic. Our nurses came from a pool of pediatric trained nurses with a rich work experience and background, specializing in the care of these children with functional impairments and chronic disabilities.
One of the devices that we use here at Salma is the eye gaze machine. So we will start off with a small frame where they can practice moving their eyes around the frame, and then they can progress to this high-tech device. We have one little girl, Sarah. When she came, she was using eye gestures because she can't move her body parts to communicate or to speak. So she would roll her eyes up for yes, and she would squint her eyes for no. And over the course of the year that she's been here, she is now using the eye gaze independently to request, refuse, to get attention, to cause trouble, to tell things that she likes, and to tell stories. She can WhatsApp, she can go on YouTube with it, so it's amazing what this kind of thing can do.
We have a speech therapist, occupational therapist, physiotherapist, and a dietitian. Next to our individual sessions that we are providing daily for our little heroes, we are also providing group sessions, which is totally different than other hospitals. So we are providing breakfast club, we are providing Islamic studies, meditation, the library, as you can see here.
We have an experienced team that consists of intensivists, consultant pediatrics, and also GP doctors that have ICU experience, so we can take care of patients that have complicated medical course, and we have modern equipment to maintain monitoring and care of the child, whether the child is in the room or doing activities outside the room or even outside the facility.
أنا والدة سلامة السيد الشامسي. صار لنا فترة في المستشفى. ما شاء الله بنتي أحرزت تقدم ملحوظ في حالتها الصحية، وإن شاء الله بتكون أحسن للأيام القادمة. شكراً لكم.
We love Salma Hospital.